So, Deborah, why is that? Do you have a hypothesis as to why there's that pay gap?
I think specialty does play a role in that. I think many of the students that we train are committed to serving in under-resourced communities and enter primary care. And as a result, get paid less. It's part of the problem we have in medicine that attracting primary care physicians often means trying to figure out how to help them pay back some of those loans and supplement salaries. LA Care as a foundation has put money in their safety net to try to help residents and junior faculty pay back their debt if they are practicing in an under-resourced, underserved community. So those are the kinds of things that can make a difference. And I think we just have to, again, look at ways to do more of that.
This is Press Play on KCRW. I'm Madeline Brand. New research out of UCLA is confirming what many African Americans already know. There are few Black doctors. Just 5% of all doctors are Black. Statistically, there's been no increase in the percentage of Black male doctors since 1940. And they earn, on average, about $50,000 a year less than white male doctors. Dr. Dan Lee is the author of the study and a professor of medicine at UCLA. Welcome to the program.
Hi, thank you for having me.
Great to have you. Also joining us is Dr. Deborah Prothro-Stith. She is the dean and a professor at Charles R. Drew University of Medicine and Science here in Los Angeles, and that's recognized as a historically Black graduate institution by the federal government. Welcome to the program, Dr. Prothro-Stith.
Thank you very much.
It is great to have you both. And Dan, let's begin with you. You used census data, and you went back really to the beginning of the 20th century. What has changed, or what, more importantly, hasn't changed since the beginning of the 20th century to now?
Yeah, I wasn't sure what I was going to find. And so I thought I was a history major in college. And so that was one of the reasons that drew me to the study. But basically, in 1900, 1% of physicians were Black, and now it's only 5% today. So that's only an increase of 4 percentage points. What was more shocking to me was that the percent of physicians who are Black men is virtually, as you mentioned, virtually unchanged since 1940. It was a little under 3% in 1940, and it's a little under 3% today. And the increase since then has been an increase in Black women physicians. And so it was basically 0% in 1940 and almost 3% today. So that gets us to about the 5% of physicians who are Black today, which is very low compared to the 13% of the U.S. population who are Black.
Wow. Deborah, your reaction to these numbers?
Well, yes, this is disappointing, but not surprising, Madeline. I remember in the 1990s when the American Association of Medical Colleges initiated Project 3000 by 2000, giving 2 years to get the number of physicians, Black physicians, up to 3,000. And that goal was not met in 2000. It's met today, now 4 decades later. But still, it's not sufficient. As Dan said, 13% of the population and just a bit over 5% of the physicians is a problem, and not surprising given all that we know about medical school, but also professional racism in society. What's happening with the police doesn't just stay at the police. It is really all over every profession we have.
Right. And so what is the cause of this? Dan focused specifically on Black male doctors, so let's talk about them. Why is it so difficult to train, to get Black men interested in a career in medicine, for them to actually succeed in becoming doctors?
Well, at Charles Drew University, we have a very good record of training Black and Brown physicians. We are a partner with UCLA and looking to start our own medical program where we can increase those numbers. But roughly 25%, but of a small class of 28, is in fact Black and Brown male medical students. So it can be done, but it does take extra effort. And again, the George Floyd knee on the neck, if we use that metaphorically and understand that there are race-based decisions that negatively affect the Black community and Black men in particular, we just happen to know on camera what's happening with policing. And I think this period of anti-racism in the United States gives us an opportunity to really take and make some strides forward. We know some of the things that work, we just need to do them.
Well, I guess, so it starts early, right? With children. It starts in grade school.
Even before, we have a pipeline program that's now about 25 years old that starts kindergarten through 12th grade, and it focuses on STEM. And so that is a huge way of moving this ball forward. But public education has to embrace science and math and has to get better at providing adequate education for students as they enter that pipeline. One of the places that the pipeline leaks is once students enter college and say they want to be a physician. And we have been working with some of the historically Black colleges and universities to model what Xavier University in New Orleans does with its pre-medical academy, and they have tremendous success. We know you have to be intentional about this. We know you have to be anti-racist and make some affirmative decisions. And what we've learned at Charles Drew is that our students, to be successful, sometimes need, I call it a special sauce, but it's old-fashioned support for some life events like the death of a parent or financial crisis in the family. And those events can derail students, the loans that they have. So we really have to pay attention to them. And fortunately, you know, Bloomberg announced $100 million to the Black HBCU medical schools. And, you know, that just gives us a lot of hope and a lot of potential to provide scholarships for students. Like I said, we know what to do. We just need to do it.
Well, speaking of money, Dan, another thing you looked at in your research is the pay disparity between white and Black doctors. And you found that the pay gap was around $50,000. That is a huge gap. And what is the reason behind that? Is it because of different specialties that Black doctors are entering less remunerative specialties than white doctors?
Yeah, I wasn't able to quite examine why that, but I think that is my main hypothesis is that a doctor is not just a doctor. Doctors train in different specialties, and unfortunately in our medical system, different specialties are compensated in different ways. And there is probably just a representation problem that Black physicians aren't represented in certain more well-compensated specialties. There was a very good editorial about this in JAMA Internal Medicine. There's a radiologist oncologist who said that he's at Johns Hopkins, who said that he's usually the only he's now an associate professor. He's usually only the only Black physician in the room. And so there's been other studies that just show that Black physicians aren't well represented in these more well-compensated specialties. And that probably explains this huge 50,000 gap that has existed pretty much since 1960.
Wow, so that's a huge gap. And also, when you consider how expensive medical school is, I think the average loan.
Exactly.
Wow, I mean, the average debt is what, $200,000 or something like that? I read that somewhere.
Yes.
Uh, so, Deborah, why is that? Do you have a hypothesis as to why there's that pay gap?
I think specialty does play a role in that. I think many of the students that we train are committed to serving in under-resourced communities and enter primary care. And as a result, get paid less. It's part of the problem we have in medicine that attracting primary care physicians often means trying to figure out how to help them pay back some of those loans and supplement salaries. LA Care as a foundation has put money in their safety net to try to help residents and junior faculty pay back their debt if they are practicing in an under-resourced, underserved community. So those are the kinds of things that can make a difference. And I think we just have to, again, look at ways to do more of that.
Well, I want to thank you both so much for coming on the show and highlighting this issue.
Thank you. This is hugely important. Thanks, Dan, for your work.
Oh, and thank you for coming. Really appreciate your insightful comments.
That's Dr. Deborah Prothro-Stith. She's Dean and Professor at the Charles R. Drew University of Medicine and Science. And Dr. Dan Lee, author of a brand new study out of UCLA about how few Black doctors there are in the United States. He's also a professor of medicine at UCLA.